Thank you for the introduction. I'll just check if Dr. Vikram is again with us because he is.
Hi, Vinita, I'm here.
Yeah, yeah,
I hope you can hear me
yeah,
correctly
yeah,
this time.
yeah. We can.
Hi, guys. So I'm Vikram from the 2017 batch, and along with Vidhi, I also matched at the University of Arkansas. And I'll be covering step two for you guys today, and looking forward to uh, trying to solve any doubts that you have as best as I can.
So to start with the session, we'll be first going with the step two topic, then the USCEs, the research, and finally the volunteering part. So I'd like to hand over to Dr. Vikram to start with the step two. I'll just stop sharing my screen, and Dr. Vikram, you can start sharing yours.
Yeah. So step two, huge thing now that step one has become pass fail. Earlier, the norm was that people really considered step one as a base for your academic knowledge to gauge how much of medicine you know. But now that it has gone to pass fail, nobody can see how much you stored. Step two has become all the more important, and important in the sense that if you are aiming for a big university program of the sorts, there are a lot of programs that have set internal filters for step two. And it's become more important in the last couple of years because the competition has gone up and the median score now for step two has gone up to 248. So now earlier people were happy with a score of 250 plus, 255 plus, but now the 260 score is the new 250 score. So scoring a good amount in step two has become important because it is as important on your CV as your rotations, if not more, and any other thing that might be on there. Okay, so step two differs from step one in it being a more clinical exam. Step one tested your basics of subjects ranging from anatomy, physiology, biochemistry, and microbiology, and pharmac. But here the overview is it's going to include subjects from your third and fourth years, and the questions are going to be slightly different from what you encountered in your step one.
So,
Okay, so it is a multiple choice exam, and what they're trying to test on step two is your ability to make a diagnosis and to know how to proceed if after making a diagnosis in a given patient scenario. They're not going to ask you what microorganism caused what disease or what nerve supplies what muscle. They're going to give you a patient scenario and gauge how you proceed as to how do you diagnose, what tests do you do, and how do you treat a certain condition. Yeah, majority of step two is medicine and the subjects you encounter in your third and fourth years, and it's an MCQ exam. It is slightly longer than step one, and I think there is a sample question after this for you to get an idea of how step two is based on. Okay, it is like I said, a longer exam, and the sample question for step two is going to be longer. This is one of the average length questions. There are questions which are an entire page long. So step two really tests your ability to filter out information really fast and make sure that you use the important aspects of the question and make the relevant diagnosis. From step one, it was somewhat simple because when you read the last line of the question, you can get an idea of what the question is trying to ask if they're asking the organism, and then you can try to mend your thinking according to that. But step two, the main difference is the history does matter a lot. The timeline of the patient, if it's an acute thing, a subacute thing, or a chronic thing, does matter. Your answer changes quite a lot. And even the physical examination, the numbers that are given really do make a difference in what you might choose. Because if the patient is tachycardic, if the patient is febrile, or if the patient is hypertensive, the management for different conditions does change. So, an important thing for step two is trying to pace yourself to not to first and foremost finish blocks and to pace yourself in such a manner that you can get through 8 blocks because this is a longer exam. There are going to be 8 blocks and 1 hour of break, including if you skip the tutorial. And if there is a scenario where a set scenario has 2 or 3 questions, then the block might be shorter. It might be 38, 39 questions as well. Okay, so this is probably the biggest part of step two, as to how do you prepare. So what I would say is, for step one, like, you had first aid as a golden resource that had everything that you needed for step one. I personally did not find any notes or step two first aid to be that useful. My primary resource for step two was UWorld. I used UWorld as a learning tool, and not just that's not just me saying that. It was actually a learning tool for me because I went system wise to get an idea of what they're trying to ask before going into time mode and trying to solve it. And the main thing for me was, I did not find any of the notes that are available online to be fitting. Either they were too long and too exhaustive for me, or I felt that they did not have enough information for me to feel confident to referring them. Um, Other resources for step two include your NBMEs and your CMS forms, which are sort of self-assessments which are made by NBME, which is the governing body that sets the paper for step two. And there are some auxiliary resources that you can use, which is at the Ambos library or the Ambos Q Bank if you're more comfortable with that, and the Divine Intervention podcast. Primarily, I used UWorld as my resource, like I said. And for the note taking part, what I did was, when I was in my learning phase, when I was trying to do non-time blocks and trying to gather information, what I did was I took all those explanations, copied them into my UWorld notebook, including tables and pictures. And I made an exhaustive notebook of what I learned from you, and and even if the information was repeated, that was fine for me. What that helped me with was, I did it on my iPad, and what that helped me with was I could copy the entire notebook and paste it in a PDF app, which helped me to use it as a notebook which I could write on and remember it from. So you can see on the screen, I have tables from UWorld, which were copy pasted just like it was in the UWorld without any loss of data. And for me to remember everything, including pictures, I could just write on that. I did not use any ready-made notes. I felt that making my notes myself and writing on them really helped me. That was my strategy. If anybody else has any other strategies that they use, you could chime in right now.
Yeah, so for me, I found the easiest way to make notes from UWorld, and like Vikram, UWorld was my primary like learning resource. I studied for both step one and step two using Anki. But basically to make notes from UWorld, I would just make my own Anki flashcards. So it took a little bit of time at first because, like, formatting the flashcards and all, like understanding how to do it in a way that will help you learn the most is difficult and time taking at first. But like as I got into the groove of it, it became much faster and it was super, super helpful for me. So if you're somebody who learns well with flashcards, I would really suggest trying to do that. Even if it seems a little intimidating at first, it will definitely be worth it.
Dr. Tejusv, please go ahead.
All right, so I think for me as well, so I know that for a lot of people, Anki works, and for a lot of people, Anki doesn't really work. So pick your poison. If it has worked for you in step one, go for it. If it does not work for you step one, you probably might not be able to go for it in step two or step three. So don't switch your gears. Do what works best for you. This is step two. I hand wrote all my notes from my step one, from my first aid. I annotated my first aid a lot. I made my dad actually like ask somebody to to like scan it and give it to me. So I've gone through like extreme lengths to conserve like my first aid notes. So do whatever works best for you. I think like note making like Vikram did is awesome. I wish I had known about this, but I honestly like drew everything by my own and like made my own 4 color pens, took my own 4 color pens and like drew stuff with it. So yeah, I think like do what works best for you. There are like different ways. And once again, Anki is not the answer just because everybody uses it. It doesn't work for you. That's totally all right. Don't force yourselves to do something that doesn't work for you. It is, although scientifically proven to improve memory retention and stuff, but if it doesn't work for you, that's fine.
Yes, because it is something that can be intimidating. So if it's not working and you're putting all that time into it, it just like it makes the whole process so much more frustrating than it needs to be. So I agree that definitely like figure out what works best.
I would like to add, I did not have a lot of time to make notes. I tried it, but at the end, it got very exhausting. So I referred something called a Scissocat notes on Reddit. It's easily available. You can Google search it. It's very extensive, but it was very helpful as I did not have time to make notes for myself.
Okay.
And I
So
think one more thing, Vikram, did you cover about Amboss?
Yeah, I used Amboss primarily as an auxiliary resource. So what I did was I had the Amboss library, and from the Amboss library, I could copy texts that I want and paste it into my notes. That is how I used it. And some people find Amboss to be a better Q bank than New World. That's fine. That's not a problem at all. If you feel comfortable with Amboss, you can use that. Amboss also has like a little self-assessment, like an Amboss 100 question thing that you can use on a 5 day trial, and you can keep making different IDs and keep using 5 day trials to solve more and more questions from Amber. That's like a cheat code that probably hasn't gone on their radar.
Yeah. So I think like in one of the sessions, some one friend of mine actually said that like you do more questions instead of like repeating the ones you made mistakes on. So I think it is a better idea to move on to a different question bank once you're done with UWorld. Do not like repeat them because you might not get so much out of it instead of like just doing the another question bank. And as Vikram said, Amboss knowledge library is, I feel like the gold standard for step two. I think it is better than like it is better than UWorld, like in my opinion. Also, ethics from Amboss is awesome. Biostats from Amboss is awesome. And you might find some guys on YouTube also talking about like biostats, which can definitely be very helpful for a lot of us in general because like sometimes biostats questions will like rack your brain. And personally, I felt that like my step two had a lot of ethics questions. So if you guys like have a different opinion about it, I'm not really sure like how it went for you, Vikram or Vidhi or Pritika, but like I feel like for me a lot of ethics questions were there. So I would have it would have been better for me to be prepared more for that. I feel. What did you guys
Yeah,
think?
I think ethics is something that you can't really learn. There's so many different scenarios and this complicated scenarios that require
Yeah.
your attention. For me, yes, like Tejusv said, Amboss question bank really has good ethics and biostats. And for those two sections, I felt that I was really weak in them. And the thing was, when I gave my step two, which was last year in June, there was some sort of a pattern change, and they included more of ethics and biostats. And for me to be better at those, I really solved the entire sections. But I did not buy Amboss for that because my primary resource was UL. What I did was take 5 day trials and just keep on doing that with different IDs because it's not that many questions. You can do those ones and you can see if you want to. But Amboss library itself for ethics really covers everything that they can ask you in your exam. So that is something that you can really look forward to using for ambiguous subjects like ethics.
So as we have come about the point of Amboss versus UWorld, Dr. Tejusv, I'd like to ask you one of the questions from the queries. Is it better to start with Amboss and then go on to UWorld during the dedicated period or the other way around?
Okay. So varies with actually not. I think like you just start with UWorld first and then move on to Amboss. Uh-huh. I personally started UWorld and then moved on. Sorry guys, you guys caught me at a bad time. It's just morning. Okay. I started with UWorld and then moved on to Amboss because I realized that UWorld is a very good resource to like practice. Amboss just adds on so much to your knowledge. And there was a strategy that my seniors followed that I learned from them. And that was like, do 50% of your U world in different for different subjects. Like if it's OBGYN, just do OBGYN 50% and to learn from it. And then you do like each different topic to learn from it. And then you do the next 25% of your world at random. And then you do your all your CMS forms in like 1 week. And then you do the rest of your U world along with like starting for Amboss questions. And that is like, so the reason why you do 50% of U world in like topic wise is to learn from it, not to test yourselves. I am saying this with a big exclamation mark. You world Amboss is not to test yourself. This is not a testing that is going on. So do not compare yourself with like the percentage you get on your U world. You've done step one. Do not do the same mistake again. It's a learning tool. It's not a testing tool. Okay, guys. Your NBMEs are also your learning tools, and you are, and that's not the exam you're gonna give. Okay, it's gonna go up. So make sure to remember that it is very important, because I myself got demotivated like multiple times every time I got like a 50% on my U world. I'm sure like Vikram and Pritika and everybody else also felt the same way, because that happens very often, and all of you guys who are doing it right now, you might be feeling the same way. So yeah, so 50% U world topic wise, learn from all of those topics, learn from your mistakes. Then the next 25% of your U world, you learn how to solve the pattern. You try to understand different questions. Then you do your CMS forms in at length. CMS forms are extremely important to like understand the pattern of the question, understand the range of topics that are there in each subject, because CMS forms will cover everything that is there in each topic. And that is exactly what NBME will ask you in your exam. And then you do your start doing your other part of the U world that's remaining. Do your Amboss questions to become more good at solving your NBMEs after that. So that's like kind of like the structure that I followed. Yeah. Did I answer your question, Vineet?
Yeah, it did.
Yeah,
So
and one more thing that comes after Tejusv's discussion is the timeline and the time that you need to give for step two. That is, I think, something that is very important. So, for me personally, what I did was I completed my internship in 2024 and got graduated. And for the entire duration of my step two prep, I was at home. So, more or less, I was in dedicated for around 3.5 or 4 months. I started slow, started learning initially, but after a while, I was as dedicated for step two as I was for NEET UG probably, or if not more. So I think giving enough time and respect to this exam is important, because this is something that will affect your CV in a huge manner. So if you feel like you're not confident enough in your testing ability, if the scores are not something that you feel comfortable with, it is not a problem at all to reschedule your test. But I feel that at least 2 months of dedicated might work for everybody if they're not working. And if you're working, the testing period should be taken when you're comfortable with your scores.
any of the speakers would like to add on about the ballpoint score that we should be looking at, or anything else?
So
The higher the
aim for
better.
the best score that you want to. I mean, no score is a good score. Everybody is going to have, always going to be someone that is going to have a better score than you. But the thing is, the median has gone up. Like I said, the competition has gone up. So
Yeah.
if you feel like you're going to score in the 240s in the actual exam, if that is what you're predicting on the basis of your preparation, do realize that it is something that might be repulsive to some of the bigger programs because of the internal filters. Even if you have a stellar CV and everything else, but if your application does get filtered out because of a step two score, then your application does not get on the table for them to review it. And I would say for everybody, a 260 score, even for IM, other surgical specialties, it's a different matter altogether. But now, even for IM, the competition has gone up, and everybody and their friends are probably aiming for at least a 260, I would say.
That's great.
True. Yeah, you need at least a 250 plus in psychiatry, in my opinion, right now, if you want to match at a good place. But honestly, like my predecessors matched at 237s, and so it all depends on your CV how holistic it is. But definitely, guys, if your step 2 score didn't really reach that high, I would say compensate in a different manner, and which is like a different conversation, honestly. But like you have to have like other compensatory factors for, let's say, low research or like low volunteering, and then you can like compensate.
So I think that essentially covers many aspects. Dr. Vidhi, would you like to add on?
Yeah, I would say that it does help that if your step 2 score is greater than your step 1 score. I think most of the people right now would have passed and failed. I'm not sure. But it does help if your step 2 score is greater than your step 1 score. It means that you have updated and your clinical reasoning is better. For step 1 was more on memorizing front. Plus, I had a step 2 score of 257, but I think I still made it. So it's fine. Just cover up in other areas.
Dr. Pritika?
Yeah, and I think another important thing to remember is just how you go about your test day. Because I mean, a lot of you probably know that from step 1 already, but it's a very long and exhausting exam. Like it's 9 hours of almost continuous thinking. So something that really helped me, there's this YouTube channel, Dirty USMLE, which has this video on like the most like basically maxing your score, like what you can do to max your score other than actually like studying and practicing and everything. Like, your sleep schedule before, what kind of food you take on the day, breaks and all. I personally, I'm lucky. I'm a fast reader, so I would always have like 5-10 minutes left at the end of my block. So I had a lot of break time. So I would take a break after every single block, even if it was literally 2 minutes, like just go drink a little bit of water, go to the bathroom and come back. And that really helped me. Like you just need a little bit of break, because for me at least, continuously doing more than 40 questions just became like super tiring. So, of course, it depends on how much break time you get. If you tend to be a slightly slower reader, you might not have as much, but do try to take more frequent and maybe shorter breaks rather than trying to have like one really big break. Though, of course, towards the end, I would say that if you still have to like, you have to be cautious with the break time you're using. Use it a little bit less at the beginning while you're still, fresh, and then towards the end, take longer and longer breaks.
Dr. Vikram, please go ahead. You're on mute. We cannot hear you.
Sorry, guys, my bad. So, like Pritika said, the exam day is where you need to shine and you need to practice your break times and making sure that you can think clearly after 5-6 hours of continuous solving as well. That is something that you need to practice by yourself and doing self assessments, mirroring the actual exam as the closer you are to the date. One thing that really helped me personally was having a study group. I think that is an underrated part of step two preparation because I feel that it really added 10 to 15 points to my score because that whatever I was studying, everybody else was studying something different. And we used to just keep texting each other with doubts and questions. And that really helped jog my memory about the things that I might not have remembered or forgotten in the few days that I have read it afterwards. So I think if you have a study partner, that is going to be very, very beneficial for you.
So I believe many points have been covered which were not even asked in the queries, but we got a detailed explanation of everything. Next on, I would like to invite Dr. Tejusv to talk about the big thing, the USCE part, about this journey.
All right. So your USCEs are definitely going to be your ace in the hole. Like, I mean, after your step two. Um, Talking about ace in the holes, there is like some data that talks about which specialty values what more. For example, in psychiatry, people, PDs, and the people like evaluating your program, your profile values a personal statement way more, and it may vary, but that's like the general consensus. So talking about USC is definitely the most important thing, definitely something I would start looking for in your final year of med school. There are different kinds of USCs, and it's okay if you're beyond your final year of med school, you can still look for other options. But just covering like how there can be like different kinds of things. So first, let's start with like a elective or a rotation or a clinical clerkship. So everything in USCE is called an elective. It's basically everything that you are doing is called an elective. This is very similar to what American grads call their fourth year rotations as electives, और उनके fourth year rotations को वो लोग sub internships भी बोलते हैं, which basically means कि वो लोग fourth year में they choose which program they want to go to, which specialty they want to go, and then they do a sub internship there, which is just like working as a first year resident, which in US the first year resident is called a PGY, is called an intern. Now that is your sub internship, and a clinical clerkship is almost the same thing. क्लर्कशिप्स उन लोगों के थर्ड ईयर के रोटेशंस को बोलते हैं, जिसमें वो लोग को एवैल्यूएशन वगैरह होता है एंड एलओआर वगैरह वगैरह मिलते हैं. एंड सब इंटर्नशिप फॉर अस, clerkships and sub internships are almost the same thing. All of these are electives or rotations. And when you talk about externships or observerships, they're all things that you should do after you are graduated. Externship is something you do after you're graduated, because what happens is when you are a student, you are allowed to do clerkships and sub internships. When you're not a student, you can only do externships or observerships. Okay, so even when you are a student and you are not able to find like good sub internships or clerkships, you can definitely do observerships. Okay, now let's talk about so what kind of like things are these? So these are all like hands-on rotations, especially the clerkships and your Vineet, can you go on the previous slide? The clerkship and the sub internship, these are all hands-on rotations. तुम जाके वहाँ पे काम कर रहे हो, you're showing them you're showing them what sort of person you are, you're showing them if you're a good team player, you're showing them if you're asking good questions or not. That's all a part of your clerkship. Observerships. So my experience has varied with respect to observership. I have been in observerships where like I have been like I've sat in the OPD and I've just like been like a third person looking at what all is going on. I've like have had very hands-on observerships as well. Luckily, that might not be the experience for you all. A lot of observerships might not give you an LOR, but some of them can. So make sure to ask about that before you apply for it. Now, yeah, definitely. And like, what about why are we doing all of this stuff? This is to like add stuff to our to our CV, which talks about that you have worked in the US system, you know how things work, because things are definitely very different. And you have a letter of recommendation from a US doctor talking about, okay, this person is not a psychopath, and therefore they can be like nice to work with, and like you don't have to worry about having them in your program. Stellar letters or recommendations are absolutely welcome. And yeah, I think there is a slide which talks about like which letter is better. Can we go on that?
Yeah.
So letters from university hospitals, definitely awesome. Like matlab छप्पड़ फाड़ के तुम्हें जो that's like definitely the gold standard what you would like want to have in your CV. पर अगर नहीं है, then you might want to go for like a LOR from like a clinic or like an observership. That is also awesome. Now think about an observership from like a very big institute. That also is okay if you're getting an LOR from that. And then Indian LORs. So the thing about Indian LORs varies with respect to specialty. Some specialties require an LOR from your home institute. Like IM, for example, they require an LOR from MIN sir. From our department. Psychiatry में नहीं लगता, उन लोग को सब बाहर का ही चाहिए. So that is that. Now, so I think yesterday in the previous session, we talked about like when to approach for LORs. I think Apurva talked about it. Basically, the idea is that when you are starting your rotation, it is good if the preceptor sets up this expectation that they're going to write an LOR. But if not, you tell the preceptor by like the end of the first week that okay भैया हमें आपसे LOR चाहिए, आप हमें बताइए हमें क्या करना चाहिए. And definitely at the end of every week of your 4-week rotation, I would ask for feedback. I would ask what can I do better. I would ask is there anything else you think that I can do better, what else can I improve on. And and by like the third week, I would like remind them by the end of it, can you write me a letter of recommendation? And that is that. Kudos, you've finally achieved. Like they say yes, then like great, like मिल गया तुम्हें LOR, तुम जिसके लिए तुमने इतना पैसा खर्च किया है, you got it. And then you have to remind them again when the ERAS token releases, when the season actually starts, ki please upload my LOR. Now, the LOR, a good LOR is not something we write, it's something that they write. So you can't really like talk about like, isme hum kya likh sakte hai. But definitely like it has to be, if there are examples that you can quote to that person, like, so my attending asked me ki, what sort of experiences you had with me that you want me to incorporate in your LOR. And that is what like we talked about, and that is what I wrote in a message to her, in an email to her, ki, this is what happened with me, this is what I want you to write in my LOR. And she wrote that, and that was amazing. Now, for that, Pritika told us a very good thing yesterday, that like, please note down your experiences so that you can talk about that in your interviews, and you can talk about that in your to your LOR writers as well. I already talked about how to request for LORs. I don't know what an SEL is. What is this?
Uh,
That's for IM,
yeah.
Oh,
the
okay. Sorry.
standard evaluation letters. Yeah, so
Okay.
Yeah,
that's
I think
basically,
that
there's a format you can get from any of us, get it signed by MYNs, or a lot of programs want that, or a letter from the department head in
Right.
IM.
Okay.
yeah,
So that
Ria
doesn't happen
talked
in psych.
about it in depth in the previous session. So if you have the recording, you can refer to her discussion about the SCL and how to go about it.
Okay.
Yeah, we'll be sharing the recording shortly.
Cool. We never required it in psychiatry. All right. Let's move on to the previous one. So when do you start looking for electives? It's something that you should do prior to starting your step 2 prep. I would say like um my timeline was kind of different. I think for people who are right now doing USMLE, if you're in your final year, I would say that given the fact that you're probably gonna doing your electives mostly in your final year, या फिर your intern year, so you would want to ideally start looking for electives at least a year in advance, because honestly, guys, nowadays electives for people like us from hospitals like KEM and like nearby hospitals हमको नहीं मिलने वाला, because we don't have VSLO and nobody's gonna give us VSLO. अभी VSLO क्या चीज है? VSLO एक common system है जिसमें all the American hospitals and all of these people, uh, they have like this system where they get students from VSLO. So it's like a centralized system. And nowadays we have to like rely on non VSLO uh, requiring electives and observerships. We have to find them by ourselves. Now, how do you do that? I think the match guy has a list of non VSLO requiring electives. Google this exact term, international student visiting elective, and you can find it. And you can find like all the international student visiting electives on your on Google, and that will like really help you out, like, and go through each of them one by one and like plan it out. Abhi tum third year mein ho to plan it out, fourth year mein ho to plan it out. If you're an intern, look for more observership positions, because definitely you can't do a clinical elective. Now, as it says on the PPT, I feel like UAB, Stanford. Now, so these are all like a list of things that you can look for. I can definitely talk about psychiatry more if anybody needs. Just send me a message. But I think more people here are IM, so I'll hand over to somebody from IM who wants to talk about like elective options.
Uh, Dr. Pritika?
Yeah, so honestly, like when I was in final year and internship, I was like, I have to do electives, I have to do hands-on electives. I mean, I basically felt like observerships are completely worthless. And fortunately, I did get 2 electives. But ultimately, when after my internship, I decided I wanted to do step 3, I also did an observership with that. And I think my observership experience was actually my best experience. I'm pretty sure, I mean, I haven't seen the LOR, so I can't confirm, but I'm pretty sure my observership attending wrote me the best LOR out of all the LORs I had. I also learned the most, and it was also a 2-week observership instead of 4 weeks compared to my university electives, but I still learned a lot more. So I know I was super stressed out about, I have to do a hands-on elective, but it's okay if you're not able to do it. Plenty of people match having only done observerships. I mean, of course, if you have the time and if you're in final year, at the beginning of final year, definitely do try to get at least one hands-on elective in, but it's not the end of the world if you don't get it, because it is a very expensive process. There's a lot of rejections. There are very very few available for a huge number of IMGs. So it's hard. And but yeah, so observerships also, there are a lot more opportunities available because it's much easier to do, right? Because if you're a student and it's hands-on, like they have to get a lot more permissions. While an observership, even though of course, right, it's not hands-on. Depending on your observership person, as Tejusv said, you can have a really good experience, and I can vouch for that because I had a great experience during my observership. Um, yeah,
I got two LORs from my observership. Only one single LOR from like my other rotation.
yeah,
So
yeah,
I mean, it
exactly.
depends on what sort of impression you make on them.
Yes, absolutely, absolutely.
Dr. Vidhi, you have something to add on?
Yeah, sure. So regarding LORs, I would suggest that you have a backup. That is, you only need three LORs and one from your home department. That is, M1 sir or anything who is going in other departments. So always have a backup. So in my case, what happened? There was a professor who was going to write me an LOR. He had to retire unexpectedly and before time because he had some personal medical issue. Fortunately, I had already asked someone else for an LOR, so I had a three in hand when I needed it. So things can happen, things can go unexpectedly in the wrong way. So always have a backup and ask more people for LOR. I know it can be a little bit anxious, but yeah, ask for LOR in the start itself.
Pauras, you have something to say?
Yeah, just some like like having gone on electives very recently. Like I have what I would like suggest in all of this, like in terms of options, is that like please do your own research. Like you do your own search for what options are available, because relying only on the lists which are available from the previous year might not be that productive, because as year and time is passing by, lesser and lesser options are becoming available. For example, I remember Cornell and USF were non-VSLO, so they were available. But like right when I was applying, that was in like October-ish, I guess. Just before that, Cornell switched to VSLO. Then USF switched to VSLO last year around in, I think, February or April or something like that. So, like, but at the same time, newer options at community hospitals are opening up. I have been reading about them on LinkedIn, or like this just coming across. I don't know how good or bad they are, but I would say it is very helpful to do your own search to look for options. Like especially like me considering I'm looking forward to doing a residency in OBGYN. So like there weren't any lists available, so what I did was like I went to Google, and then first I went to Wikipedia and took out a list of all the universities which exist in the US, and then went to the website of each and every university and made a Excel sheet of like specific to OBGYN. That is like if they're applying, if they're offering to IM but not OBGYN, I've mentioned it accordingly. But I mentioned like whether they needed step one, whether they needed TOEFL, and what are the application cycle timelines, as in like when do they open applications, what blocks or what time of the year uh, they allow international students to take electives, because some universities are very specific that when US students are taking electives, they don't let international students, so on and so forth. So making a Excel sheet like that, maybe you can pair up with a friend and divide universities and stuff like that. Because like when somebody said I think Pritika said about this about the match guy, or somebody said like about the match guy list. I did see that, but like when I was looking at it, it wasn't like updated. So keep on searching for options manually by yourself, so that like if at all, if there's something which is not known to others, and if it pops up, then that's like useful to you, right? So that's what I would suggest. That's all.
We have Dr. Vikram to add on something about his experience. You are on mute, Dr. Vikram.
Hi, just a couple of quick points. So, if the websites do not have all the information in their international section, what you can do is they always have a program coordinator or an international student coordinator that you can reach out to and make sure to ask them when the application is open for the next year if you're in the third or fourth year. And then you can have all your documents ready by the time that the application season opens, which is usually around March or April for most universities. And the documents you will need are immunizations, police clearances that you can get from the passport center, and maybe your CV, personal statements for individual places. And the other thing is, if you are going for an observership, do not think of the experience as you standing back and seeing what they do. You can make yourselves useful in an observership in different ways as well. You can keep engaging with the preceptor and asking questions and trying to understand what they work with, trying to see how they use their EMR and not using it yourself, but trying to ask doubts on them and make sure the preceptor knows that you want to and know how to use the EMR by yourself. And if you are ever at a place doing an observership which has a residency program, and say you're in a super specialty rotation like cardiology, and you can do the best thing you can do is just network, keep in touch, speak to the residents, speak to the IN faculty, make sure that they remember you, and if you can get their contact details and keep in touch with them if they're happy with you. And you can also present during their Zoom conferences and stuff, which is something that is important that can go on your LOR, because that is something that is expected of you as a resident to give presentations and present topics and give like morbidity, mortality reports and stuff. So that is something that you can do to make yourself useful, even if you do not have a hands-on rotation.
Dr. Pritika, please go ahead.
Another point I wanted to add is like while you're applying for your electives, also start figuring out visa stuff if you don't have a B1, B2 visa already. Definitely during my time, there were very long waiting periods for getting like visa appointments and all. For me, like I had got my acceptance for an elective already, but it was like only months later that I was finally able to get an interview. I think the situation is definitely better now. That's also just something to keep in mind while you're doing the elective applications and all of that.
So,
All right. One more thing, Vineet. I'm sorry. This is
yeah,
important. So we need to talk about agency rotations. A lot of you guys will get messages from agencies. You'll see online agencies and all these stuff. Now, agency rotations are kind of tricky. I would definitely research those rotations before applying for them. A lot of these programs are toxic and malingering programs, and like I would not go there personally. But if you know somebody who has done that specific rotation, ask them to give you the contact of the preceptor, और तुम्हें वो $3,000 का rotation $500-600 में करवा देंगे. So make sure to reach out to your seniors. And definitely reach out to your seniors who have done rotations. They can like put you in touch with people you might not even know exist. And otherwise, the agency rotation that I tried was SST overseas. No, a lot of people did USMLE Sarthi. I know one of my seniors who mashed into MIMO like way back. He did all of his externships after his internship in psychiatry through USMLE Sarthi. Definitely paid a lot of money, but he matched. So if you don't have any options, observership bhi nahi mil raha hai, kuch bhi nahi mil raha hai, definitely go for these. So just keep on a lookout. कुछ नहीं मिल रहा है. So सबसे पहले you should look for for universities. University based observerships are also good. अगर तुम्हें elective नहीं मिल रहा है hands on, then you start looking for observerships, like in general electives, observerships, and then that doesn't work out, then look for clinics through your contacts who have given people good LORs, and then go for your agencies as your last resort. Or I would like use agencies to fill in the gaps between my rotations. Like जैसे अगर मान लो तुम्हें 4 rotations करने हैं, तो just अगर if there is 1 month, you ask the agency to put you in touch with somebody, and then like you can just like still do a rotation. I would say university observership better than clinic hands-on, but that's coming from a perspective of psychiatry, where a lot of thing is actually just seeing and talking. It's not really hands-on. But definitely I would like it would vary. Um, and one more thing, nowadays it has become important to have more USCE as compared to previous years. देखो यार, 4 USCE हम लोग usually standard मानते हैं. But if you do more than that, I would say definitely way better. You might not want to include all of them in the 10 experiences you have in your ERAS application, but having more USC definitely improves your chances because you get to talk about a lot more stuff on your program, on your list. And yeah, we can like you should have like varied US clinical experiences. For example, I had inpatient, outpatient, I had clinic rotations, I worked with forensic psychiatrist, child adolescent psychiatrist. So I like try to keep the experience as varied as I could, and that really helped me a lot because by the end of my rotations I was really confident in applying for like jobs and stuff. So keep that in mind. Your rotation should be varied. सब कुछ अलग अलग एक्सपीरियंस तुम्हें आना चाहिए. एंड अगर तुम्हें 4 से ज्यादा मिल रहे हैं, भले ही तुम्हें LOR नहीं मिले, आई वुड से कि भाई ले लो. मतलब डोंट वेस्ट योर टाइम, ले लो. इट इज वेरी इंपॉर्टेंट in this current scenario where things are way more competitive. Definitely 5 or 6 is, for IM at least, is like a gold standard. Maybe for other specialties as well. For psych, I think like 5 is good enough.
Anybody amongst the other speakers would like to add on this point about the number of USCs for IM?
I
So
think
I
I
applied
definitely.
directly after.
Sorry, go on.
Yeah, you go on, sir. I will continue. Okay, so I would say, Pritika, is that all right?
Yeah, go ahead, go ahead.
Yeah, so I applied directly after my internship, so I did not have that much time to do multiple electives, so I did three. So I think even a small number, 3 to 2, is fine. Just have a good amount of letter of recommendation and do it from a good hospital so that they can write you a good LOR.
Yeah, I agree with Vidhi. I mean, definitely, of course, like the more you can do, the better it is. But like again, like you, even if you just have 2 or 3, that's fine. I had 3 technically, but my it was only 2.5 months of USC because my third was only 2 weeks. Another thing is that often when you are a lot of these electives tend might not be with just one attending. Like for example, yeah, in both of my hands-on electives, I had 2 weeks with 2 different attending. So one elective does not necessarily mean just one LOR. You might be able to get 2 or even more LORs from one elective. So yeah, that's what I wanted to add.
I'd like to ask Dr. Vikram to add on the point whether what is to be done during the electives and how to ace them and what are the tips and tricks to be active.
Okay. So what they want from you as a medical student is to make sure that you are professional and you can work with people, and that you have a good understanding of the US clinical system because it differs so much from the system over here. So make sure that you are on time and you are professional. You speak to everyone, not just doctors, not just resident, even the nursing staff. Make sure that you have a connection with everybody you see on the floor. I think that is the best thing you can do. Make sure to not piss anybody off if you can, because it is very easy to do that. And I would say just don't stand behind and absorb everything. Make sure that you are actively involved in decisions and make sure your thoughts are known, even if you are not confident that they are correct. So the preceptors are there to teach you. The rotation is there for you to learn. And yeah, if you just stand back in an elective and just be a passive observer, it's not going to be very well reflected in your LOR. If you do more things, like I said, if you try to present in their room conferences and stuff, that adds something different. Like every LOR does have basic things that you did. You use the EMR, you took patient histories, examine them. But things like these, doing research with residents, showing that you have enough research capabilities or you have good presentation skills. I think doing extra things like these during your rotation and even after that can help you really stand out.
I believe we have covered on all the points about the USCs, the details from where to apply, what to do, and how to just be on a follow-up to get the LORs. So I'd like to next invite Dr. Vidhi to talk about the big area that is research, whether it is necessary, what to do, where to start from. So over to you, Dr. Vidhi.
Yeah, sure. So research, I think, is a very complicated stuff because it's a golden opportunity, but first it's difficult to get. It takes a lot of patience, and there are chances that it not might end up published. So it's like all your work has gone to waste. So things like that can happen. So I think the most important task when it comes to research is to start one, because that would, I think that's the first and most difficult part. So I think first we can start with some simple research, like you can do case reports, systemic review, narrative review, as these things take shorter amount of time. And I personally have even completed a systemic review in 1 week, so it is possible. I would suggest that you pair up with your USMLE students. You can also pair up with your seniors who would be actively doing research in their residency, as they also don't have a lot of time to do research. So you are also helping them, and they are also helping you. So I think doing systemic review, case reports, narrative writing would be the starting point, and then you can move on to more complicated stuff. For example, during my electives at Yale, I wrote a case report with the associate there. So you can also use this opportunity to do research in US, which would be more valuable than doing in India. But that does not mean that doing research in India is not valuable. I think even doing a very minimal research is valuable. For example, in my second year, I wrote a very simple research systemic review on monkeypox. When I read it now, I find it very simple and very idiotic, but this is something that was asked to me even during my interviews, and it does matter. It shows that you had interest in research, you started early on, and you have the knowledge on how to go about it. For example, in university programs, I might want to do fellowship in Hemong. So it shows that I would be able to do research during my university program as well, and that I have in-depth knowledge of it. So basically, they just want to see that if you can go through various pages, sort out relevant information, and then put it together and present it. So I think that's the main point when it comes to research, and it is a very good an initiator topic during interviews. I think in all of my interviews, I have been asked about my research, and I think the first and foremost opportunities you will get is through your seniors, through your friends, and also from mentors at AEM. I think that there is an Aspire group. I was a part of it. So you get very lot of opportunities through it, and I would like you to be part of it and make it useful for yourself. I had a mentor. I think those who are doing internship would know. My mentor was Nitin Sarate. For research, he is a good mentor. I would recommend you that you could approach him. He will help you do any ICU based research. I can guarantee you that. He's a bit a tough guy, but when it comes to research, he will definitely help you out. Also, you can connect with your seniors who are doing residency so that you can help them write a research paper, and in turn, they can also help you get published. So I think I saw many questions on how many research publications are important and what all. So I think basically it does not matter a lot, but I think having research knowledge does. Because they would ask you questions and they will know gauge how much of the research have you done and whether you know how to go about it. So I think this is just an overview. Is there any question I did not uh, answer or something, or anybody else wants to add on?
Uh, Dr. Tejusv, would you like to add about the importance of research in your field, the psychiatry?
So I think so I had two papers. One I did not publish, but I presented multiple times, which definitely added a lot to like my presentation section in the eras. Uh, so भले ही मैंने उसको publish नहीं किया हो, but I was able to like present it at multiple conferences, won a ton of conferences just on the basis of that presentation. So, and it was like in hematology, which was definitely not the same as psychiatry, but it gave me that experience, and I was able to like talk about it more. Now there was this another paper which was like very unrelated in pharmacology that I did in my second year. It's like my first research paper ever. And honestly, I didn't even think that any of the PDs would bring it up. But sadly, actually, a lot of them read through it and they brought it up in the interview. So honestly, if you have some research paper that you have done even a tiny bit of work on, and which is like not even related to your field, I would definitely say कि भाई you should know what you did a work on, तुम्हारा नाम किस paper पे है, because even if it's like related in the remote past, people will still ask you about it. So don't be a ghost writer. ठीक है, ऐसे खाली नाम के लिए पेपर मत करना, नहीं तो तुम्हारी बत्ती लग जाएगी. People will figure out the exact moment that like you don't know what you did research on, and that will like that's like a big red flag, and that only anybody can only find out when doing their interviews. So that's why people really like to ask about it. So yeah, that thing. And yeah, on the same note, even if you do unrelated research from your field, it is totally fine, because at the end of the day, research is research. तुम्हें मतलब you're getting the experience, and nobody expects like a medical student to have like a shit ton of publications. If you do, that's in my opinion a red flag. It means that like either you have like have had like तुमने कोई गलत तरीके से बहुत सारे रिसर्च पेपर्स को एक्सेस किया है. मेरे ख्याल से तो गलत है. अगर मैं चीफ रेसिडेंट होता तो मैं वो बंदे को वहीं पर ही रिजेक्ट कर देता, बोलता कि भाई मुझे नहीं चाहिए ऐसा बंदा. सो एज अ रेसिडेंट आई डोंट थिंक आई वुड अप्रिशिएट दैट. बट एनीवेज, गुड क्वालिटी मीनिंगफुल रिसर्च, भले ही तुम किसी भी छोटे से टॉपिक पे कर रहे हो, दैट इज ग्रेट. Cap studies, in my opinion, are the worst things to do. It is great to like learn stuff on. I'm sorry, guys, if anybody else has done that, but cap studies, knowledge, attitude, practice, knowledge, attitude, whatever it is, I feel like it's not really that useful. I mean, and medical students pe karna is like a very overused resource. So definitely not something I would suggest to do. But if that is all you're getting, if it is helping you build experience to go on to like more complicated research projects, you can definitely do that. And on a final note, uh, review papers like narrative reviews, meta-analysis, systematic reviews, scoping reviews, they are great to do as a medical student, because you really don't need IRB approval for that. क्योंकि वो simple review paper है. तुम कहीं से भी बैठ के टॉपिक निकाल के किसी भी टॉपिक को रिव्यू करके उसमें पेपर लिख सकते हो. अच्छा लिखा तो तुम्हारा पब्लिश भी हो जाएगा, तुम उसको प्रेजेंट भी कर सकते हो. But honestly, I mean, a higher quality of research would be definitely be like, case control studies, your cross section analysis and all. तो उसके लिए डेटा चाहिए. पर अगर डेटा अगर तुम्हें नहीं मिल रहा है, you are short on time, I would say definitely do review papers. Uh, I know meta analysis को time लगता है, but scoping reviews and narrative reviews you can do in a shorter period of time. And definitely you can reach out to your seniors जो लोग कर रहे हैं research या any resident who can help you with that. US से data लेना is not possible. So you can't work on US projects that involve data in the United States, because उसमें फिर वो HIPAA violation and all the बहुत सारे rules आ जाते हैं. So you can't do that unless somebody else is ready to like analyze the data and send you the results, and then you write the discussion. That's a different story. But somebody has to be able to like do that. So keep those things in mind. यूएस का कोई बंदा है, तुम उसके साथ रिसर्च मतलब करना है तो पेपर्स रिव्यू पेपर्स वगैरह कर सकते हो.
Okay, so I believe that it was a comprehensive overview of the importance of research and where to start, and regarding the fields as well. So I'd like Dr. Tejusv to continue about the volunteering part, the last part of this discussion, and how it's important in your field, especially.
All right. So I ran a big NGO, like kind of a big NGO, but did a lot of work in volunteering in my second, third year. Anytime I saw somebody come to me and say ki I want to be a part of this NGO because I want to do USMLE, because I want to show it on my CV, it was a big red flag for me, and I rejected that person's application right then and there. So if you come to me and say that you want to work for the community and say कि ओ मैं USMLE के लिए कर रहा हूँ, मैंने बोला भाई ठीक है मेरे को नहीं चाहिए. The moment you don't find this work as going on a CV, you'll stop doing that. So if you are gonna do volunteering and you're gonna say कि you're just doing it for the CV, please don't do it. It makes no sense. Rather do something else. Rather do something you actually find some interest in. If you're volunteering something, it has to be a more meaningful experience. Volunteering without having any point to do it, it's not going to help you. You are not going to be able to talk about it in your interview. Interviewers are very smart people. They have been doing this for years. They'll pick it up in an instant कि भाई इस बंदे ने फेक काम किया है, इसको हम सिलेक्ट नहीं करने वाले. People can read it through in between the lines of your experiences. So unless it's like a meaningful experience, don't even waste your time doing it. Find something more meaningful. There are a lot of volunteering opportunities and sorry, before I say that, volunteering opportunities do not exactly have to be in medicine. You can do in other different aspects as well. Yeah, I know of my anesthesia med student who's working on a suicide prevention helpline just because he likes working on it. And that is a very meaningful experience which works on मतलब तुम बहुत ज़्यादा time के लिए कर रहे हो, so you build up a lot of experiences in that. So things like that where you actually have like a lot to give is a good experience. Uh, I would definitely not recommend doing like one-time workshops because वो कैसा होता है कि तुम एक बार कोई कैंप करने गए और उसके बाद तुमने कोई फॉलो अप नहीं किया, तो क्या पॉइंट रहा. इट्स लाइक मतलब तुम जा रहे हो और फिर तुमने आई डोंट फाइंड इट मीनिंगफुल. मतलब तुमने क्यों किया वो. इज दैट योर गोल दैट यू वांट टू डू इट फर्दर, देन व्हाई डिड यू नॉट डू इट अगेन. So that is why like volunteering in something you find meaningful is very important, because guys, remember this again and again, whatever you do, you are going to have to talk about it in your interviews. तो अगर तुम कोई फेक चीज कर रहे हो तो उसका कोई पॉइंट नहीं होने वाला है. So that is why some of the things that I found really helpful was for example like working in my own NGO. And basically उसमें भी what I did was more of like a managerial role. I didn't exactly like work on the ground like teach students, but mostly getting that experience as a team leader was extremely useful because it played very well with like how my entire picture of psychiatry came together, and also how I did like a lot of like suicide prevention helpline pe kaam. So that was like a very long meaningful experience that really helped out my application immensely. So look for like meaningful experiences like this कि जिसमें तुम लंबे टाइम के लिए काम कर सको. I know Robin Hood Army is great. I know that like MAD is great, make a difference. I know Samaritans India does a lot of work. So these experiences where you can actually make some impact, that is really good. एक टाइम का कोई कैंप करना मेरे हिसाब से तो गलत है. अगर मैं चीफ रेसिडेंट होता तो मैं एप्लीकेशन को देख के बोलता इसने ज्यादा एक्सपीरियंस नहीं है. But yeah, so and the importance of volunteering is definitely to talk about like how you want to give to the society. It is bringing out your different aspects of your personality, like working as a team outside of medicine. Are you giving to the community or not? Now, I already talked about like what considerations you have to make while choosing a place where you volunteer at. Like definite मतलब nobody is gonna ask you for like a certificate कि तुमने ये voluntary का सर्टिफिकेट किया कि नहीं किया. But definitely कि अगर तुमने मतलब कुछ meaningful किया है, you will be able to talk about it. That's more than important. Now, opportunities के लिए यार, I think a lot of NGOs have their own thing on Google. So go and find out more stuff. I already gave you some hints. I think others can also chime in and talk about this. Now, all right, I guess like talked about psychiatry. Psychiatry, mein, since suicide prevention is a big thing for me, I personally believed in that and I did that. One more thing that I did was I was more passionate about student mental health. So I started like mentoring my own students in KEM. So that again for me was like a very important thing that I did personally, and that showed a lot of initiative from my side to my interviewers कि भाई ये इंसान खुद से कुछ चीज उसने कोई चीज आइडेंटिफाई करी एंड उसने जाके उसके लिए काम किया. Okay, so all right. Anybody else has anything to chime in on?
I'd like to ask other speakers about their experiences on extracurricular activities or about the volunteering in the IM field.
I can go on this, Vinit. So for me, I was a person that was involved in a lot of things in college, be it sports, be it administration, be it just something that I really liked. So for me, that was something if you guys don't know this about me, I was originally planning to do NEET and I switched over to USMLE during the start of my internship. That is what happened. So before that, these things for me was something that really were appealing to me, and that is why I did them. And it really helped me grow as a person as well. And for them, for the programs, you as a resident does have to be someone that is able to work in teams and at times lead teams, because if you're alone on night and you need to organize everything and stuff, you're going to be the point person on that. So I think leadership roles are really important as well. My era CV, in my experiences, had a mix of these. I had my experiences, I had my sports thing, and I also had my administrative experiences as well, which were really, which were really, which really stood out, I would say. And I got asked a lot of questions about how I went and why I did it, and I could speak about them for like the amount of time I could answer. I could go on and on, but I needed to keep it precise and stuff. But yeah, if you do feel that you are somebody that likes being either in the gymkhana, either in some committee, or can have other leadership positions, say in sports or something like that. I think that is a really nice point to show that you are not just someone that is focused only on medicine, only academics, not just a bookworm. You are a kind of person that can work well with other people, can gel with other people, and if the opportunity does arise, you can take leadership and do good things with it.
Thank you, Dr. Vikram. That was really insightful. So I think we have come to the end of the session. We do have some unanswered queries. I would like the speakers to just go ahead. So regarding the USCE part, we have three queries. I have summarized them. So the first one is how to build a CV for university electives, and what are they looking for, and the so this is the first one. Would any of the speakers like to go on?
I guess like you could do more stuff in the gymkhana. Sorry, Vidhi, you want to go ahead?
Yeah, I was gonna say the same thing. I think during the electives, the marks and your overall CV, that is volunteering and extracurricular activities, is something that's important because you don't have other stuff. And I think step one, score and TOEFL.
Okay.
Now that step one is pass fail, I guess it makes no difference. But definitely marks वगैरह का देख के. But I never had an experience where like I got rejected on the basis of my, well, actually, yeah, I'm pretty sure I got rejected on the basis of my CV for like a lot of university electives. And I guess like if I had more research, maybe it would have been a better option. Because I know one of my friends who had like a shit ton of research on her profile, got like Cleveland electives and all that stuff. So I guess like that definitely does make a lot of difference, showing that like you are very interested in all of this. But other than that, I think like being more up, like being more into extracurriculars, just having more stuff on your CV to even like put there. Because I found it really hard to have so much things to even just like have on my CV before applying for electives. I guess like that's what it was.
So the second question is somewhat partially unanswered about the how to be very good at networking during your USC, so that you can open doors for more opportunities later.
I'm gonna answer that one. Sorry, guys. I had a very good experience with all of my preceptors in my research in my rotations. One of the residents that I was working with, I used to like stay with her like till she was done with her work. Just like, okay, I don't want you to sit here alone, so I might just stay here with you and just like chat with her and just be like a nice person. Don't indulge in any politics or don't try to put anybody else down. Just be nice and just show that you're nice and be just genuinely interested in whatever's going on and talk about your experiences, talk about your, because you are just understand your position. तुम बाहर की किसी country से ये गोरे लोगों के साथ आके बैठ रहे हो, ये अमेरिकन लोगों से जाके बैठ रहे हो, वहां पे तुम जाके उनके साथ just talk to them, just like tell them how you are passionate about what you're passionate about, and they'll talk about what they are passionate about, and that might somehow, like, make them put in a word for you later on. Like that's really helpful. So my one of my current mentors is actually somebody I met on my one of my rotations, and that dude is from India, but he's like an attending here, and like that really helps. Like that's how you connect with people. You find more people, you find more residents you're working with, ask them if there is something you can do to work with them because you really enjoy working with them. Not because, please don't say, I want more research or I want you to put in a word for me. So these are like some avenues how like you connect. And definitely, guys, your seniors are awesome. Like I'm not I'm like talking about everybody else. I'm just saying that like all of my seniors were super awesome. So many of them like put in a word for me when I needed when I needed an interview. And like honestly I feel like एक दो मेरे जो interviews है वो मेरे seniors के through ही आए हैं. So definitely 100% keep in touch with them. We are also human beings like you all. We like when like our juniors talk to us, and we don't mind putting in a word for other people, and we don't mind sharing our resources because somebody did that for us, so we want to do it for other people, and that's why we are doing this session anyways.
Yeah. So anybody else would like to like really add on their personal experiences about this point about opening new opportunities and connecting with people?
I don't know about psych, but in IM, if you are doing an electives in a super specialty, for example, I did GI at Sinai. There is an every day there is an IM conferences. So tell them that you want to attend these conferences, go to that conferences and then network with other IM residents. So in this way, you get to know the institute, the university, and you can also connect with people there. Just don't check up with all the fellows in the super specialty. Talk to other people also and try like communicating with them those also.
So I believe that was the only three unanswered questions regarding USC. Apart from that, research, volunteering, everything has been comprehensively covered in this session. So yeah, I'd like to thank all these speakers, Dr. Vidhi, Dr. Tejusv, Dr. Vikram, and Dr. Pritika. I believe she left due to some work.
Before
So
we finish, sorry
yeah,
Vineet,
please,
sorry to
please
cut
go.
you off.
No,
Anybody
please
has
go.
any other questions?
Yeah. You can put them on the chat.
Or you can just raise your hand and like ask a question if you guys have any. Otherwise, we can just end it. Vineet, you can stop presenting.
Yeah, sure.
I guess that's it.
Yeah.
Oh,
Order of resources for step 2. Would anybody would like to talk about it?
I'll go ahead. So the resources really do differ from person to person. Like what I use, they just to use an entirely different model of it. So the common resources that do overlap between the two of us are UWorld Question Bank, maybe Amboss Question Bank, Amboss Knowledge Library, Anki cards if you're into that. But one of the non-negotiables when it comes to step 2 is your CMS forms and MDMEs, because all these other third-party resources are set by people in the corporation, right? But these CMS forms and MDMEs are set by the people that actually set your paper. So for you to get an idea of it, of what they want from you, how they set the questions, and where they can trick you, or just pretend that they're tricking you into thinking too much, but they just want a simple answer. I think NDMEs and CMS forms are some of the things that you should not skip when preparing for step 2. Maybe you can use divine intervention podcasts if you want to just keep revising as well. There's a discussion about if you actually should listen to the podcasts or you could just listen to the transcripts. I personally found it boring for myself because he was very like slow, and I really like to read instead of listen. So I found this transcript on Reddit, which had almost all of the important chapters noted by people, and I think that was really a revision tool for me because it was just a summarization of everything we had learned from our question banks and libraries.
So that summarizes the question, the most recent question we have. So I believe we don't have any other questions. So yeah, we'll conclude the session for today. Thank you all the speakers. It was really great
Bye.
having you. Bye bye.
Bye.
All the best, guys. Bye bye.